My name is Dr. Kundlas. I'm a primary care physician in Florida. Multiple patients recently who were complaining of very vague symptoms, including fatigue, tiredness, numbness, tingliness. And one of the most common reason in our community and in United States in general, and possibly worldwide, is B12 deficiency. So I thought of creating a video so that it could be educational and helpful to my patients and to everybody who wishes to take a benefit of that. In this video, I am going to cover multiple topics to know why it's important to take vitamin B12 supplements and who are the people who are most vulnerable to develop B12 deficiency, what this vitamin B12 does for us, how we could replace it, and certain diseases which we should be careful about and take care of them properly. And we'll also touch upon the multiple testing could be done, and we will discuss whether it's important to get into very detailed testing versus taking daily nutritional supplement which is recommended. So let's start our video with why B12 is important. In our body, liver is the organ which stores about 3 to 5 milligram of vitamin B12 for our daily needs. And we lose about 1 microgram daily through different resources, but it needs to be replaced daily, otherwise our resources will be depleted and we will have difficulty in maintaining proper functioning of the body. B12 is required in the synthesis of red blood cells. It repairs DNA. It is very important for our psychological and our neurons or nerve cells. If we have deficiencies, we will be anemic, we will have less repair of our DNA, and we will get changes which sometimes could be permanent in our nerve cells, leading to multiple symptoms. Whenever anybody is anemic, we feel tired, we feel weak, and with B12, it also affects the function of other cells in the blood, including platelets. You could have easing bruisabilities. You will be tired, you'll be irritable, and you will have less concentration and focus. When it is not available for DNA repair, you age faster, and for your nerves and cells, it leads to certain, sometimes irreversible changes in the spinal column, leading to permanent numbness, tingliness. So it's important that we prevent its deficiency so that we do not develop any of these symptoms. It also can lead to irreversible loss of memory and some psychiatric symptoms, including depression. That's why it is very important that we get our B12 level checked. Most of the primary care physicians will check your B12 level once a year. This B12 is very important in also synthesis or metabolism of one of the protein amino acid. This amino acid 12 is also very important in the metabolism of one amino acid, which is methionine. In the deficiency of 12, this methionine metabolic products get accumulated and which affects our nerve cells, leading to central nervous system symptoms, psychiatric symptoms, and memory loss. Now let's discuss why we should get B12 checked. There are a lot of controversies regarding how we check the B12 level, and unfortunately, the B12 level testing is not very reliable, and the symptoms most of the time do not correlate with the levels, which means that you could have a low level and then it's very clear that you need to be replaced. But if you are running normal level, still you may be functionally deficient in B12. There are two other blood tests your doctor may order, which is MMA and homocysteine level, but this is very controversial. MMA level get also affected with other diseases, but they are more specific for B12 deficiencies. Homocysteine level will also be affected by another vitamin, folic acid, which will affect your same red blood cells, DNA repair, and nerve cells. So we want to ensure that we replace both folic acid and B12. In normal human body, when we consume B12, it goes through our salivary glands in the mouth. It gets bound to one enzyme which is created by your salivary glands. Then it passes down into your stomach, where our stomach lining has specialized cells which called parietal cells, which produce two very important chemicals, hydrochloric acid and intrinsic factor. For B12 absorption, we need both. Then the food is passed into our gut, where in the duodenum it's also acted upon by pancreatic enzyme, which cleaves off certain things and adds certain things, which prepares it to be absorbed in the smaller intestine. So if you have a problem with your salivary glands, stomach, or intestine, you could develop deficiency of B12. And there are certain diseases or medications which we use to take care of patients, which are very important, which I will touch upon right now, which will affect the level of B12. Let's start with salivary glands. That's why most of the time we do not recommend taking oral tablets of B12. It's recommended either it should be replaced with formulation which could disintegrate in your stomach so that your salivary glands can act on it, or we give intramuscular or subcutaneous, or if you are taking tablets, then you must chew it. Then it passes on to the stomach. In the stomach, anything which reduces acid production will lead to difficulty in absorption of B12. Most common things are your acid reduces. We use a lot of medication which reduces acid production, including Pepsid, omeprazole, Protonix, and these medications lead to permanent B12 deficiencies if it's not corrected. And certain diseases of pancreas will, as alluded before, will affect the absorption of B12. If you have a problem with the area of your intestine, which is the last part of small intestine, we call it terminal ileum. If we have disease there, most commons are Crohn's disease and celiac diseases, that will lead to complications and your vitamin B12 is not going to be absorbed. Other major reason for B12 deficiency is if you have a gastric bypass, then it will definitely lead to multiple problems and we may not be able to absorb it. But the biggest reason in our community is dietary deficiency of B12. In the United States, most of us are meat eaters and we should definitely get sufficient amount of vitamin B12 in our food, but people who are primarily vegan and plant-based or eat very little meat, they have very high risk of developing B12 deficiency. And anybody above the age of 50 will develop B12 deficiency. So it is recommended that everybody above the age of 50 should develop or take B12 supplement. Now, let's discuss how much B12 is needed. On daily basis, we require about 50 micrograms of B12 to be taken every day. Or if you are somebody who cannot take B12 every day, then you should consider taking 1000 to 2000 micrograms once a week. So it is very clear that B12 is very important for our bone marrow, our nerve cells, and our DNA repair. And the most important thing is that we must prevent this deficiency, as the tests are not very reliable. So there is always a question which we must answer. Is it that we need to start taking B12 till we develop laboratory findings indicating that it is low, or we should continue to take B12 on a daily basis on the recommended doses? It is recommended that you should take 50 to 100 micrograms every day or 1000 to 2000 micrograms on weekly basis. I hope this video will provide you some insight into regarding B12 and you will be able to make a reasonable and informed decision. Thank you very much.